Hello, good evening to everyone. Thank you for joining me. I'm Dr. Philip McMillan, and I am continuing to do a global tour with regards to understanding the outcomes of the COVID-19 pandemic. Part of that is to discuss with clinicians at different parts of the world to understand what is happening in their country and the implications of how it is that we can assess what were actually good and predicted outcomes for the pandemic. As part of that process, I'm re interviewing Dr. Matt Shelton. He's from New Zealand. He was one of those people who stood up with a voice and was absolutely challenged and taken down because of his position with regards to vaccines. And so we have the tremendous pleasure of having him back again, where we'll go through the history, we'll go through what's happening at the moment in New Zealand, and critically, his very important work with regards to helping research across the world. So, without further ado, I'd like to quickly add in Matt. How are you, Matt, today?
Hi, Phil. I'm very well. It's really good to see you again.
Excellent, excellent. I'd just like you to introduce yourself to the audience. Presume they have never heard about you at all. Just give us a little bit of background as to who you are and what it is you've done.
Sure. Well, I've been predominantly a GP for most of my medical career, which was 36 years. And I was suspended by our medical council here in 2021 after I sent a communication to my patients in my general practice that I wasn't, comfortable with the informed consent process and that people should do their own due diligence rather than relying purely on the government's single source of truth, as they describe themselves. So I was suspended in 2021. I actually won in court. I challenged that suspension. Three of us did actually, and we all won the following year. But the medical council immediately proposed to resuspend me for different things I'd said and done subsequently. And I've chosen not to reapply for my annual practicing certificate because I saw the problems that some of my colleagues had in a similar situation. And frankly, I've just been working very, very hard on non-medical, non-clinical issues anyway with our group, NZ which started as an open letter very early on, just asking questions and expressing some concerns. To which we got absolute silence. So we realized straight away that this was bigger than we'd anticipated, and that we could be in a fair bit of trouble. So we've sort of got together as a group and grown considerably in the last few years, and are really working to continue to try and get some accountability from our regulators and our politicians and the decision makers all the way through this pandemic and its response. So there's been plenty to do. I certainly miss clinical work. I mean, I've done it for 36 years, and I miss my patients. But this is a huge fight, if you like, for medical truth and freedom, and it's not going to happen on its own.
That's fascinating. It's frightening almost, Matt. And when we think about it, when I was reflecting just recently about the responsibilities from a whistleblowing point of view, so meaning that in every organization, there is a duty or a protection for whistleblowers if you have a concern. Now, it doesn't say the whistleblower has to be correct in order for them to whistleblow, but I do wonder, is this not theoretically a whistleblowing kind of situation? You have a concern, you don't think it's right. Isn't that what we are encouraged in all sectors to do when we see something that is not quite right? Any thoughts on that?
Yeah, look, you're absolutely right. I mean, we've been doing more than blowing a whistle. We've been trying to scream from the rooftops. And of course, you're right. It is, generally there is a responsibility on anybody in any profession or industry if they see harm or potential for it, that people speak up. And I guess the best known sectors where you would expect this would be medicine, where we have a duty of care not just to our individual patients, but we have a sort of sentinel function, a lookout duty that doctors have always had in their communities. for the first signs of problems. But the other industry, of course, is the airline industry. So, there's been this see something, say something culture that has been very correctly, introduced to try and overcome the barriers that people might feel to being, a lone voice. Now, in the case of medicine, not only is there the fiduciary obligation to, if necessary, stand in front, stand between your patients and, harm that you might see. We are expected to go that extra mile, and most of us learn that early on, or if not, certainly as we go through our careers. But we say that we should have protection also under legislation. And here in New Zealand, there is an act called the Protected Disclosures Act, which should protect employees who go to their employers, or in our case, our regulators, with concerns. And our regulator has, in a way, acted as an employer, because through its guidance statement that it issued in early 2021, and in fact, many medical councils around the world produced a very similar sounding statement around the same time, which said that we expect you to be vaccinated. So, it was the first real sort of vaccine mandate, actually, that a profession in New Zealand was subjected to. But we expect to be mandated, and you expect you to be vaccinated. And also you can only say positive things about the vaccine. And the implicit threat was, if you don't, you might lose your job. So we feel that they were actually acting as an employer, and that we ought to have protection under legislation. But of course, that hasn't happened.
It raises an important question, Matt. And I had always said at the beginning of the pandemic, certainly with the mandates and so on, that the reality is that they were putting themselves in a position where they had to be correct, meaning that there was no leeway for error. If there was error, they were going to get absolutely hammered because of it. And this is therefore what has happened. It hasn't worked out the way that they had anticipated. And so therefore it comes back to that question. If there were other clinicians who were concerned, who didn't raise any concerns, are they therefore on the other side of the question negligent in their actions?
Yeah, we may have touched on this last time. That is a very important question. However, I think you have to have, we always have to try and have compassion and understanding, for everybody in every situation. And it's not the fault of most doctors that they were threatened with their livelihoods, having first been, had the pants scared off them by this very overblown idea of this deadly pandemic, this unprecedented global health emergency, as we were all told over and over. And it's not the fault of the majority of healthcare workers, and perhaps even politicians at that time, that they were beguiled and scared by this story that was projected. However, years on, everybody should have, calmed down, woken up and reflected for themselves on, all the questions that have been asked since, all the evidence that's come out and the information. And we think the responsibility lies very firmly with the key decision makers, but that includes our own medical council. So actually, we are challenging them in court next month. Well, in fact, this month, in about 2 weeks, in Wellington. The legality of the guidance statement that they produced, saying, get vaccinated and don't talk about the downsides or the fact that this thing has no safety data and is experimental, which actually is the advice that we were given by our medical indemnity insurers that we ought to say. They advise that we should say exactly that in the context of an informed consent consultation. So, the whole situation is very complex, but the fact that the majority still, and I'd say the large majority, are keeping quiet is a reflection more on human psychology and group behavior and the pressure, the carrot and stick, that was used on the medical profession, rather than, innate failings, of people as individuals, because we're all only human. But, medicine has a tradition, or it should do, a history of putting itself between the patients and harm. We have this duty of care that isn't just a nice to have thing. This concept of the fiduciary obligation is very powerful. It comes from equity law, which is the basis for all of our constitutional and administrative law. And it says that, we have this extra burden of responsibility for our patients because they may be disempowered by fear, pain, anxiety, lack of information. And we have huge power. We can remove a lot of this. What's the saying? We can cure sometimes, relieve often, and comfort always. And so that extra power that we have in our interactions, brings with it an extra duty of responsibility, and that should include, well, in fact, it trumps and stands above other obligations, to the edifice of public health, to the sort of political considerations of regulatory boards, and behind politics, of course, there's always money and economics and finance. So, we that's been the great failure. We do think that a truck has been driven through the kind of foundations of ethical medicine. And really, we're just trying to continue to speak up for that and speak up for patients, for all of us, actually, even if people think we're bonkers or we deserve what's happened to us, with losing our licenses. We think we all stand to lose, if medicine has changed forever.
It raises a question then. Have you got any thoughts with regards to the very consistent approach across the world with regards to medical councils? Different. I was talking to somebody in Malaysia who is going to be going to court as well in September. Dr. Shetty is also going to be going to court as well. In some period of time, yourselves, similar things have happened in the UK, in the US, in Canada. What is going on?
Well, wouldn't we all like to know? I mean, we are working very hard to try and find out. And, it is no accident that there's been a sort of lockstep, resistance to what we say is medical tyranny. And, you can't just remove a long accepted sort of ethical code from medicine, without, really bad things going on to happen, because that's human nature. We all agree that there need to be codes of behaviors and codes of practice. All professions have them, but that's also why we have, religion or sort of spiritual guidance, because without any of those basic agreed rules, it gets pretty nasty pretty quickly. And there has been a coordinated attempt to silence dissenting voices for what was very clearly, very early on, and this is the bit that really puts my blood pressure up, not as bad as it was made out. Those of us that have worked a long time, and it's no accident that most of us in NZDSOS, and I think other equivalent groups around the world, are perhaps older and more experienced. So we've worked through seasonal influenza epidemics and other viruses and things. And this was quite clearly really no different, in terms of the severity. And all the norms were trashed, and all of these things that had never been done before or had been tried and discredited, like masking, like social distancing, locking up healthy people, ignoring, the demographic that would most benefit from quarantine, if they were sick. Still needs an explanation as far as we're concerned. And we're still asking questions and pointing these things out, because they are a sign of something much more fundamentally wrong, and sort of bigger moves behind the scenes. And, one of the memes is show me a conspiracy theory that in the end doesn't have a lot of factual basis for it. And you've only got to listen to the ravings of some of these people, in Geneva, and we all know who we're talking about, or people who crow that they've turned their 10 billion into 200 billion through, the decade of vaccines, to kind of wonder, well, look, this isn't just crazy. Throughout human history, bad people have always done really bad things to the rest of us. And I don't see that there's anything any different. Why are we ignoring history and ignoring what we've learned about human nature, and what we see in our own lives all the time? Sometimes there are just bad eggs, and when they have the financial muscle, the sort of the technological, weapons, if you like, why wouldn't they make a play? We think this is really a sort of a very important and a kind of battle for the sort of the spiritual as well as the physical soul of humanity, given how many people have been injected, for instance, and the lies we were all told. You've got to scratch your head and decide, how is this relevant to me and my life and the life that I want for my children and the people I care about and myself going ahead? Might this in some way represent an existential kind of threat? Because if it does, and I'm just going to keep my head stuck in the sand, then I'm in trouble. And if these people who've been saying, calling out the problems from the beginning, actually turn out to be right, how can we expect them to work miracles if there's just a few of them and they're on their own? We've all, I think, got to start thinking for ourselves, and as a collective, we could move mountains, but we have to, get our head around the change. This normalcy bias is very powerful in humans. We often get accused of having selection bias, and we only focus on, the negative data. But in fact, if you're looking at a treatment, an experimental treatment that's brand new, any negative data should stop the rollout in its tracks, until its implications are understood. And that's been the norm for a long time. And then suddenly it wasn't. So, this idea that that everything's hunky-dory, and normalcy bias, as I say, I think it runs very deep, and it's very prevalent. And stories, well, I mean, they're not just stories. The facts of things like the white rubbery clots, for instance, really need to be shoved under people's noses. And the people that are saying it's nothing or it's not happening, essentially they're in cloud cuckoo land, because we're talking about a real, tangible, physical, in-your-face change in the human body that many people are denying or just being silent on. And
You
that's a
know,
symptom of something really, really bad.
since we've gone into this, I mean, you've taken me into an area we're going to discuss. So I can
Mm,
say that my involvement of it was when I started with the interview with Tom Haviland, who has been doing
mm,
research across the world. And as usual for me, from a scientific point of view, I have learned that you discount nothing. Meaning, if people
right.
are observing something, they could tell me they're seeing blue balloons at 10 o'clock in the night at the same time in the same place. Unless they have got a mental health issue, you should investigate it, and check and see if there are blue balloons, whatever. So in this case, with so many embalmers saying that they were noticing a change in the amount of clotting, to the extent that it it impacts on the amount of time it takes them to do a process that they are paid for, that's very relevant. Now, they may not be medics, but they've observed something that we would not observe normally, because we don't do that procedure. Even in an autopsy, we don't flush out all of the blood out of the system. So they are seeing something that only they can see. Why in the world would anybody ignore what they're saying?
It comes back to human nature, Phil, and group psychology, echo chambers, fear of speaking out. And there are two very powerful um, parables, aren't there? Fables, if you like, that continue. We continue to come back to these that explain, our frustration at what we're seeing, and that is, the elephant in the room. Everybody ignoring, a giant problem, and the emperor has no clothes. This sort of groupthink where people collude unconsciously to ignore or deny, the obvious, and they will, even very smart scientists who think, well, I'm in charge of my rational mind, and I'll believe it when I see it. In fact, they're operating the other way around. When it suits them to allow new information to change a preciously held belief, then they'll acknowledge that information. Their senses will allow them to, well, their mind will allow them to see what their senses are bringing in. So, we're up against very powerful group psychology, and I think that's been used against the population. I don't think people understand the extent to which they've been manipulated. And this has got nothing to do with IQ or intelligence. And in fact, the smartest people actually have the most to lose in terms of maybe losing status or being shamed within their groups. And so they tend to work even harder, to use all the defense mechanisms that we all use to protect themselves from, that emotional pain. So it's breathtaking for me to see how this has happened on a large scale, and to see, human psychology playing out, and being manipulated, and turning against people. But this hasn't happened to all of us, and there are more and more people who are starting to understand that maybe they've been lied to, or they've been tricked, and they've got to trust the evidence of their eyes, which is the most basic sense. And this is why I come back to, I think that the rubbery clots issue is so important, to not let get brushed aside, because at its most basic, science is the process of observation. And so you can argue about numbers and the interpretation of data, and all-cause mortality, and what are we seeing under a microscope, what might it represent. But the reality of rubber clots, when you've seen them, and as you say, when people who have never seen them in their professional lives suddenly start noticing a change, and as you've demonstrated, this isn't just embalmers, this is interventional radiologists, and people who work in cath labs. These people can't all be lying. Why would they? It's only a risk. There's only trouble, in speaking out and saying what you think you're seeing. There's no money to be made. Quite the opposite. We can lose our careers, and yet we're telling the truth.
A quick question on this, Matt. When did you actually, for the first time, take the Embalmers Clot question seriously?
So we saw some stuff by Richard Hirschman online. He said he was seeing these things. And then we had an embalmer in New Zealand contact us and say, look, I've been keeping a record, and 90% of the deaths that I am working with, funeral director and embalmer as well, seemed to him to be within, well, he was keeping records, they were within 2 weeks of being vaccinated. So they were predominantly elderly, but they all had this vaccine history, recent vaccine history. And he was finding these clots in the bodies he was embalming, around about 30% by memory, which is very similar to the survey results that Tom Haviland has produced. And we've since spoken to 3 others, quite recently actually. We caught up with them again and put out a post just updating, and they're continuing to see the same things. They know that it's happening across the industry. They know that the various funeral directors associations are trying to keep the herd in line, and don't like it being discussed. But they have no option, because they are professionals at what they do, and they're noticing a change. And just like with the airline pilots, Captain, you need to listen. This is a very important phrase that they've been taught to use if they think that there's information, showing problems and it's not being acted on. It's the same thing. Houston, we have a problem. And these people are just honoring their professional obligations.
And what's the strangest thing you've heard about these clots in what you've come across so far?
Okay, so we had a patient come to us who'd had an operation and had a post-operative drain, and these clots appeared in the drain, and it was draining lymph. So this wasn't just apparently occurring in the blood, but in other vessels. Now, of course, the embalmers are really only injecting their embalming fluid into the larger blood vessels, and they have several sort of ports of access. But the notion that this is occurring in other fluid compartments in the body, and in fact, that observation gave a real impetus for the science group that has recently put out a sort of hypothesis of the sort of chain of chemistry that they think is going on, to actually understand better what might be happening. But I guess that, the really strange thing is how long and substantial these things can be, um, you know, at the time of death. But it's very clear these are happening before death. And in fact, the movement of blood down blood vessels, bringing the various raw ingredients that end up composing these clots, requires it. So you need a heartbeat. And these are growing. They're attached to the vessel wall at certain points, and that's probably where they start. But they're growing freely in the lumen, in the middle of the blood vessels, in the direction of the blood flow, and they can get relatively huge. And it's obviously happening slowly at a particular speed. So people aren't necessarily getting symptoms, except that we know, don't we, that many people are turning up with clotting issues. Emboli and thrombosis, DVTs, pulmonary emboli, strokes, and things. And the testimony of people who work in, emergency acute facilities where you can remove these things and save lives is that some of these clots are the white rubbery clots that, again, they've never seen before. So, they look unusual. They are, clearly an abnormal response in the body, to something that's new.
Yeah. Important point, because people keep on saying this when I look at the comments and they're saying, well, if this was serious, we would have heard about it and there would be some kind of paper on it. And I'm saying, no, actually, because anybody who is a professional who actively does that research is going to have their career decimated. And even this group that is working to try and get answers has to do it very, very quietly. This is very concerning for science.
It is. It is. We're in uncharted waters, and more evidence that this is really, really bad is that we wrote to all of the Australasian colleges, so Australia, New Zealand, colleges of radiology and physicians and surgeons and emergency medicine and general practice, to say, look, please explain. Here is what people are saying is happening. What do you think's going on? Will you please survey your members and see if they've seen anything? And just please respond. And it was absolute silence. We didn't get a single reply from anybody, although we know that a lot of the emails were opened, and in fact, even a few of the links that we included were put up. Now, we posted that letter, as we do with all of our open letters, and there's many dozens now on our website, so people can see what was sent. And we try and be polite, we try and be courteous, and we try and couch things as scientific questions. But at the end of the day, somebody's got to fess up and either refute what we're saying, but they'd have to say, well, all the people that have brought these clots out are lying. The clots themselves are fake somehow. And they are doing the rest of us a gross disservice, because until it's acknowledged that something bad is happening, well, in fact, we've been saying that many bad things have happened. There's any number of shoes that have dropped around the contamination of the vaccine and what's happening to people. They should have been stopped years ago, of course. In fact, they never should have been rolled out. There was already trouble, and very important questions that haven't been answered before the first person was injected. But these people are not lying, and these things are real. And to pretend otherwise is all the confirmation I think we need, which is that there are very powerful forces behind the scenes that must be active, to shut this all down. I mean, I can't think of any other explanation. The why is the key question. It's not just enough to present this evidence, but to then have to just deal with silence says a lot in itself. And I think we all need to be very concerned.
Yeah, and I had an interesting email because people do email me about stuff. I mean, I had the whistleblower reach out to me, but also a clinician who used to work in a practice working on lower limb embolectomies and so on, and doing that kind of work. But interestingly, he said he was actively looking for these issues, but he didn't see it. Now, I realized when he said that, that was very important because they were doing elective cases. The people who therefore are going to see it are the whistleblower I had who are talking about emergency unwell cases. And that suggests that there needs to be a triggering factor to therefore make this happen. And this is probably why we're seeing it in people who have died or people who've had very serious complications. So I am looking at it from a perspective that this is actually an event that probably occurs, which triggers this whole process starting and occurring very, very quickly. But it is very, very interesting, and something that I agree with you has to be addressed by the medical community. And in my view, I'm trying to work out where is the negligence here? Is it the medical community? Is it the scientific community? Is it the regulators? Is the embalmers oversight? There's got to be somebody who is responsible for making sure that any abnormal pattern or any whistleblowing is acted on in a coherent fashion. Have you come across any kind of example of this before?
Not that I can think of in my professional life before COVID, for sure. But I think the analogy with the airline pilots is a very important one because everyone will agree that safety is paramount. If you're hauling hundreds and hundreds of people around the place at 30,000 feet, when things go wrong, no matter how rare, it tends to be pretty spectacular. And yet the various airline pilots associations around the world have, they know that there's vaccine injuries, have plowed on with actually loosening the regulations around medical testing of pilots, and particularly the ECG parameters that ought to trigger, a question mark around somebody's cardiac health. So if the airline industry, of all industries, seems to be following lockstep with this culture of kind of casual neglect of safety issues, then I suppose we shouldn't be surprised to see it happening across the board. But I think medicine is a special case, and it should be held up to be a special case, because when things go wrong, again, they can go wrong terribly on an individual level, and particularly around the issue of children, and of course pregnancy, which is the hill really that all doctors should be prepared to die on. They should be defending pregnant women, or women of childbearing age, from any risks. I mean, you take a Panadol, and somebody will say, "Oh, be careful. Do you actually need that?" We're so cautious and careful, and yet right from the beginning, this particular absolute was trashed, along with others. But you asked me, when you might ask, when did I first sort of see a problem? And there were several things that stuck out as a lifetime practicing doctor, and that was one of them. This kind of reckless, safe and effective in all stages of pregnancy. Before we knew it would be, And there's been worrying evidence that has accrued that again has been ignored and not discussed. But very credible and experienced people saying what they're seeing in their practices, and again confirmed from other levels. So if you have a specialist saying the same sort of thing, saying something, you think, well, okay, well, other people who work in that industry, like midwives, for instance, may see the same thing, or funeral directors who would normally deal with stillbirths, or medical photographers that would take photographs of newborn babies, but also of stillborn babies as a memento. So from these various different places, you're getting confirmation that the same thing is happening. So there's this kind of internal validation within medicine and within the different specialties that things are changed and that there are bad things happening. And so the other thing was this notion that if you inject an aqueous solution into a muscle, it somehow only stays in the muscle and doesn't go everywhere the blood goes. That turns several hundred years of injecting therapeutic substances into muscles on its head. We've done it because we know very quickly it can go everywhere. And yet we were supposed to just accept this sudden radical, 180-degree turn on these very important and kind of fundamental truths that we've all accepted and practiced on without batting an eyelid. And many people didn't bat an eyelid, and I think that's because of the combination of fear, of the infection itself, and the sort of very slick psychological marketing of the need to protect your community, the need to do what you're told, to stay in line, all do the same thing, care for each other, and we were fed lies in order to make us believe that needed to happen. And I think we should call them out for what they are. This isn't misinformation. This is lying.
Matt, one of the challenges is that certainly I have found that once you speak about Embalmers Clots, you get put into a category of a conspiracy theorist. Now, the question is, if you take that one step further and you go into the category of vaccine nanobots, you are therefore an ultra conspiracy theorist. Now, I am saying this because I just recently did a video on this paper that was produced by two people, one in South Korea, one in Japan, about changes or things in the vaccine. I think you know something about this. Can you give us a little bit of insight into what is going on?
Well, I stood in front of Parliament in early 2022 because we'd bought a microscope and had a look at the Pfizer vaccine, and it didn't look like vaccine should look like. We didn't know what we were seeing, but we knew that it was different enough that we wanted some explanations. And again, there was just silence and ridicule, and it's all sort of rumbled on. So I'm actually in front of my medical tribunal next year for making statements, making hypothetical statements without any evidential backing, and not looking at finding a balance of information to back up my statements. And yet, as far as I was concerned back then at the time, if this was evidence of contamination and if there were going to be harmful effects, then the important people had to actually make that decision. It wasn't for me. It was just for us to say, hey, look, this is what we're looking at. And we knew that from the Pfizer contract, our government wasn't able to do its own independent quality assurance. They told us that they would do that, and they told us that they would be following up all vaccinated people. But they then later admitted that neither of those things could happen. So we assume that there's contract clauses. So somebody, though, had to say, look, please take this off our hands and tell us what might be going on. We tried to get a meeting with our medicines regulators and with government ministers and things. And a couple of hours before the meeting, they just all pulled out. and we were told, "I'll just take it up with the, use the public portal for reporting potential problems." So we did, and we wrote. But it could have been evidence of contamination that might have been deliberate. And so I felt that we had to actually get this information off our hands, because if it did turn out that the samples that the jab had been spiked or something, and we hadn't spoken up, not only would we have been morally at fault, but we could have been criminally liable, for sitting on information that could have prevented harm. And that's been the way that we proceeded with all of the concerns that have cropped up all along the way. Now, the issue of what's in the vaccine obviously is very emotive, and it's very difficult. And people like the researchers who've published the paper that you've commented on, are doing their best in a very difficult and sort of dangerous environment. It's not just dangerous professionally, but when you are a lone voice in the wilderness, there is a tendency to be shouted down, and for establishment science to sort of pile in and have a go. But really, all these people are doing, I think, is asking questions. And I know Daniel quite well, Daniel Brody, but I know that he's in a group and is well connected with a lot of other scientists and who have been doing similar work. So the paper that they have published, I think, is a proxy for plenty of other people producing similar findings, some of whom have been brave enough to go public, but many others, I think, aren't, because as you rightly say, it's it's a very, very hot potato. And to be, I'm no longer bothered by being labeled a conspiracy theorist or an anti-vaxxer, because I know that when those terms are used, they're not aimed at me. They're aimed at anybody else who might be thinking of coming alongside the argument, or who have similar views. They're just trying to shut down the community. So that just, for me, confirms that we're right about what we say is going on, is that people in high places are using their power and authority to shut down a very important area of discussion.
Yeah,
Because
I
people
wanted
are
to
dying here
say,
and losing a lifetime of health. So we need to just be realistic about what's actually happening and why it's important not to be shut down, and to look at everything, even if it turns out to be, if we turn out to be wrong about things, or our understanding of what we're seeing, but we shouldn't ignore it because other people criticize.
you made a point there that I had said to someone, is that when I looked at the paper, one of the authors was an obstetrician and the other one was a professor of linguistics. But when I looked at the paper itself and the research that they did, I thought to myself, they definitely had professional help. This is not the, and so I realized, just as you said, this looks like a proxy paper. They were willing to put their names on it, but the research was actually done by very experienced independent scientists who probably couldn't publish that on their own because of the implications to profession and standing and so on. And so this is why I said to people, forget about who the authors are. Just look carefully at what they did and see whether or not the methods that they used were appropriate and replicatable and were relevant to what it was showing. That's what I said to people, because that's the only way you can get this research done. And as you said, and evidenced by the Embalmers Clots, the people who are doing the research know that they can't say who they are. This is a challenging time for science.
Yes. I think Youngmi Lee, who's the Korean fertility specialist, she's actually a fertility specialist, not just a gynecologist. So she does IVF. So, she's used to microscopes and sterile environment, and working with body fluid, and the sort of careful scientific method, I think. And you know, I know Daniel, and he actually has a very important professional background that's far more relevant than his linguistics. But he is a gold mine on the way that language is used to propagandize and force ideas and arguments onto people. And I think that it was very important that somebody like him had a kind of an oversight into the structure of the paper. But I think that there would have been plenty of people who were giving advice around technique. And in fact, 5 minutes on the internet will show that there are many groups, actually, other than these two, who have looked and published similar findings. And to sit quiet and to ignore what seems to be new, unusual, strange world. And look, any of us can buy a microscope, and we can immerse ourselves in the microscopic world and be agog at what we see and try and attribute meaning. But at the end of the day, if we're told it's a vaccine, and we know what vaccines look like under the microscope, and then you see all these very different structures and forms, and there's a consistency of what people have seen, and a wide range of different techniques used for microscopy, and all right experience within the field. That's true as well. But there are people who spent their whole lives, pathologists, looking down microscopes, who say, again, I have never seen this type of vasculitis, this inflammation in small blood vessels before, or I haven't seen these structures apparent in drops of the vaccine. So, what about it? What's going on? Let's talk about it. But you can't talk about it because you get the same response that, Galileo and Copernicus and Semmelweis, all these people who in the end were validated, but it might have been hundreds of years after they were persecuted or poisoned or driven out of town or whatever. And that's human nature. And we're at another point now where we're having to deal with the emotional and psychological distress of scientists who can't accept these new things that they're being presented with. Well, that's their problem. In the meantime, we've got a humanity to try and protect and understand what they need to be protected from, and so we just have to plow on. And look, we don't always get it right. Absolutely not. And some of the interpretations of what we're seeing, may be wrong, but the facts of what we're seeing, stand up and need validation, and need plenty of other people who are at the moment busy complaining to actually have a look themselves, rather than just refusing to touch it with a barge pole, which is the general response, it seems.
Yeah, yeah. So coming to as we're wrapping this up, I'm interested, Matt, as to what is happening, at least even anecdotally, in New Zealand, because New Zealand represents a very unusual part of the pandemic, because they largely locked down before the variants arrived. They largely managed to keep the population away from the original variants. They vaccinated most of the population. And then when they opened up with Omicron, we then see almost a new pattern of disease, because we wouldn't have seen this. It would be one of the few places like Australia where they were largely vaccinated before they were exposed to the virus. So this is a proper challenge study, vaccine challenge study. That's what you do. You vaccinate and then you expose. What is happening on the ground at the moment in the context of New Zealand? I've seen some newspaper reports. There's a lot of pressure on hospitals in the winter. What have you heard?
Okay, so we hear a lot from colleagues still working, and especially from patients, and we all have our own experiences in our own lives and families and friends and things. But if you ignore that and you just look at what's in the media, it's been very clear since really since COVID came to town, and that was in a population that had largely had their first and second doses. So we didn't get our COVID waves until really sort of mid to late 2021. Then the seasonality has been lost. The last 2 summers were very busy. The hospitals are overloaded. There are queues of ambulances. People are being treated in ambulances because there's no room in the ED. Waiting times are immense. This is also true in the waiting for outpatient clinics. We hear from many doctors, GPs, that they're overloaded and overwhelmed with the number of sick people. So I'm making generalized sort of reductive statements. But I guess one of the things that's very obvious is the constant clamor of ambulances. And we operate a health line as well in Do SOS. So there are doctors that are still working that staff that. And we hear a lot from patients who come to us about their experiences of trying to get help, trying to get be seen by specialists, trying to get their symptoms taken seriously. And the overall picture is one that I think is similar in other countries too, and that is that there is an overload. So the hospitals are dealing with more of all the same things they would usually see: more infections, more strokes, more heart attacks, more kidney disease than before the COVID years, and certainly before the vaccine rollout. But this is in primary care as well, and it's impacting on elective operations. So there seem to be rolling waves of sickness also amongst staff. So there's a sort of a double whammy. There's an increased demand, and it seems there's real staffing problems as well. So that sort of combined to produce, as you say, endless stories in the papers and on online media. Establishment media just agreeing that things are really bad. Now we don't see things getting any better anytime soon. And it's actually devastating for those of us who've worked in health our whole lives. So I think we can genuinely agree that probably the health system has never been on its knees as much. And in fact, I have a GP colleague who's still working, and the words he used, he says, Matt, the Rome is burning. It's beyond help. We're going to have to start again at some point and try and rebuild. So that's just my personal perspective, and I'm not speaking as a working doctor, of course, because I don't. But we're pretty comfortable from, again, triangulating different sources, and living on the ground. That there is a huge demand. There's a huge burden of illness. There's rising disability. There's turbo cancers. There's sudden deaths in young people who weren't expected to die. Across all demographics, but it's particularly noticeable in the young. And yet there's difficulty getting data. I mean, I've been trying to get cancer statistics out of our health system using the OIA process, and they're just not fessing up. And I said, look, there is concern that there may be an epidemic of cancers, and especially in young people, and happening aggressively and with very little time from diagnosis to death. And the funeral industry is confirming that, and probate lawyers are confirming that too. So why don't you release the data so you can reassure us and put our minds at rest, and people can maintain confidence in the health system? But no, they're just absolutely mute. And there've been myocarditis study as well. In fact, there's 2 that we've been promised the results of for over a year now, that the health system's sitting on, for whatever reason. Again, if there's no problem, and if the vaccine's safe, release it, and then we can all see. But I think we all know that this is happening so much and in so many countries that things are not good, and people have to make their own deductions as to what it all means. But we're pretty confident that it means that things are bad. So just come back to your question. Usually the summer you heave a sigh of relief, and you can put your feet up and things as a doctor. But certainly the seasonality's gone, and there's been research showing that the same things happened in other countries, and we've had our fair share of COVID. People still testing positive frequently. I think we're up to about the 7th booster here. I think that's the most that I've heard that people have had, but I know they've just approved the 10th in the US. So, at some point people have to ask themselves, is what they're doing working? And if it isn't, perhaps they'd better stop and ask questions why.
Yeah, excellent point. So thank you very much, Matt. What I would like you to do as we finish up now is I would like you to tell the audience a little bit more about NZDOS SOS and how they can support this very valuable work that is supporting research across the world.
Sure. Well, these things cost money. We're just about to put on well, in fact, two conferences here in New Zealand. There's one in South Island and one in North Island. We've got some international speakers coming, and we had a very successful conference last year. And we think that's very, very important, that people can connect with each other, and we should be tested. We should be tested for what we're saying. We write lots of open letters. We do our own posts and we host other posts. So people can donate from our website. It's fairly straightforward. So just going to nzdsos.com. But we also need people to be speaking out and to be connecting with like-minded people. Not just for their own sort of emotional support and things, but to be activist. We know that people are kind of coming around to the fact that they've been misled and there's been lies in the last few years, and getting through that is a process, and it does take some time. But we're not going anywhere. We think it's very important to stand up for what we think is right and to try and work out what the truth is, and then not to protect people from it. So it's not our job to decide what people should know or what they shouldn't know. That's for the bureaucrats. So we really value people engaging with us, and we want to hear from people within the health system. What they see of what's going on. So we're running a project called the Truth Project, where we host they're mostly anonymous accounts of people with what they're seeing, so we can confirm coercion and refusal to report vaccine injuries, and the extent of harms, and the way people have been treated themselves as well for dissenting. We want eyes on the fact that we're in court on the 21st and 22nd. No, sorry, the 23rd and 24th in Wellington to challenge the medical council's, the lawfulness of the guidance document that they put out. And we've funded a number of other cases too that were very, very important to test what is happening in the judicial system. It's not just about the vaccine. We're very concerned about what's being done to the emotional health of children around gender ideology. We're one of the few countries left in the world that fluoridates. Still, it's compulsory, that again breaches all human rights and all ethics. So we're sort of a hermit kingdom scientifically from that point of view, we're just obligated to keep pushing, and it does cost money. So we're very grateful for our amazing supporters, who I think feel that what we're doing is very, very important. And if we can be a model for produce templates for action, and particularly in the courts, and as much as people might dismiss their usefulness anymore, are they still representing the interests of the people, or corporates behind the scene? Well, we have to keep exposing whether or not that's happening by taking actions. If we lose gloriously, that can be very, very important as a window into what may be happening. And then people have to decide: are we happy with this? Do we think this system is still working in our interests? Or do we need to get involved at a grassroots level and actually make sure that we have a say?
Excellent, excellent. Thank you very much, Matt, and thank you, audience, for being with us. And we hope that you find this information as valuable and interesting as we have. So thank you again, Matt, and just stay with me now just until after the outro. Have a great evening, everyone.